Hello everyone, welcome back to my YouTube channel. How are you all? I hope you all people are doing good. Today we are gathering here to discuss on a very specific and important topic, that is in anatomy physiology, about the abdominal regions and body system, and we will discuss body cavities also. Okay, so why we will discuss this one? Because of this topic, today's topic is very much important about clinical examination point of view, patient assessment point of view, and for your exam also it is very important. Without these reasons you don't know means you will not even check on patient also. Okay, so today we are going to learn about anatomical in anatomy physiology, abdominal cavities, body cavities, all the systems, what are the systems we are having, and about the body cavities. So before starting, already you people know, previous class we discussed about organization of human body. So all of you remember, I think so, we discussed first our body is made up of cells after, that is tissue level, then tissue after it is organs, and organs after system. These are all the system forms: first cell level, cellular level, tissue level, organ levels, and system. Okay, so and today we are going to mainly focus on the systems and body divisions. Okay, so first we will discuss about anatomical regions. So today's topic is anatomical regions. Anatomical regions. So in that totally 9 regions are there. Total 9 regions are there. So one by one we will discuss. First, before list out the regions, I want to draw one picture for your better understanding. Suppose this is one human body, and here we are drawing, I am dividing this body into 4. Okay, so here you can see 1, 2, 3, 4, 5, 6, 7, 8, and 9. Total 9 regions came. So one by one we will discuss. this first one, this one first we are going to discuss. First one is right, because this is in right side, right hypochondriatic. Hypochondriatic region. Second one, that is epigastric region. Epigastric region. Third one is, this is right side, that is left side, left hypochondriatic region. Hypochondriac region. Fourth one is right lumbar region. Then fifth one is umbilical region. Sixth one is left lumbar region. Seventh one is right iliac region. Right iliac region. After that, eighth one is hypogastric region. Gastric region. And ninth one and last one is left iliac region. So here you can see first one is right hypochondriac region. Second one is epigastric region. Third one is left hypochondriatic region. Fourth one, right lumbar region. Fifth one is umbilical region. Sixth one is left lumbar region. Seventh one, right iliac region. Eighth one is hypogastric region. And ninth one is left iliac region. Now I will show you one picture also, then it will be very much clear. See, this left side image, this side image. Here you can see number 1, this one, number 2, 3, 4, 5, 6, 7, 8 and 9. See, here you can see right hypochondriatic region, epigastric region, left hypochondriatic region, right lumbar region, umbilical region, left lumbar region, right iliac region, hypogastric region and left iliac region. So like that we also divided here. Again, if our abdominal cavity we are divided into 4, see, you can see in this right side image, here only abdominal cavity we are divided, means it will become 1, 2, 3 and 4 division will be there. Right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant. So these are like 1, 2, 3, 4 we can divide into 4 only. If we are divided only umbilical, our umbilicus we are divided into 2, 4 means it will come like this. Again now we are going to total 9 region, you understood. Again now we are going to discuss, we are going to discuss epigastric region. For what we are using epigastric region? So simply we are going to discuss epigastric region. We are checking for stomach pain. Epigastric region, we are checking for stomach pain. Umbilical region, we are checking for intestine area because their intestines are present. Next we are going right iliac region, that is for appendix. Okay, so these are the areas we are checking. Epigastric area we are checking for stomach pain. Umbilical area we are checking for intestine area, because here you can see all the intestines are present. See, umbilical area, all the intestines are present. So intestine we can divide checking by umbilicus region. And right iliac region appendix are there. Okay, so mainly we are diagnosis, what diagnosis we are doing? Appendicitis, gastritis or any kidney problems we will there, means we will check these areas. Okay, now we will list out body system, how many body systems we are having. Next point is body system. In human body, there are total 11 11 system, major systems. What are these? One by one we will discuss. First one is skeletal system. Next one, muscular system. Third one is nervous system. Fourth one is circulatory system. Fifth one is respiratory system. Respiratory system. Sixth one is digestive system. Seventh one is urinary system. Eighth one is reproductive system. Nine one is integumentary system. Integumentary system. Then 10th one is endocrine system. Tenth one is lymphatic system. Lymphatic system. So these are totally 11 systems we are having in one human body. First one is skeletal system. Here we will discuss all the bones, joints and names of the bones, joints and all we are discussing in skeleton system. Then muscular system. Muscular system, in that how many types of muscles we are having, tissues we are discussing in muscular system. Then nervous system, all about the nerve tissues, veins and capillaries we are discussing in the nervous system. Brains and all, spinal cord we are discussing in nervous system. Then circulatory system. Circulatory system we are discussing about the blood, means hematology. Blood we will discuss. We will discuss about RBC, WBC, platelets. About heart also we are discussing here only. Then respiratory system. Respiratory system we will discuss about the lungs, about how our lungs is, the lungs, alveoli and all about we are our breathing system we are discussing about respiratory system. Digestive system means how our digestion will come, stomach, intestine, large intestine, small intestine, duodenum, like that everything we are discussing in digestive system. Urinary system means kidney, filtration, nephron and ureter. Then full all we are discussing in urinary system. Reproductive system means all the gonads we are having, that one we are discussing how the reproduction process full we are discussing in reproductive system. Integumentary system means sensory organs, how our skin will be there, our means eyes are working, then all that is all in integumentary system. Endocrine system means all about hormones, how many hormones we are having, from where they are secreting, like hypothalamus, pituitary, all functions we are discussing in endocrine system. Then lymphatic system. Lymphatic system also all the big blood vessels and all we are discussing in lymphatic system. Okay, so these are the 11 systems we are having in that. I will show you one picture. In that picture onwards you will get all the photos, all you can remember. Okay. See here all the systems we are having, in that system onwards you have to remember. Okay, see Here integumentary means all the skin, hair, nails and glands we are having, what are the functions is there, we are discussing in integumentary system. Cardiovascular system is heart, blood and all, that one, and their functions and all we are discussing in cardiovascular system. Or here circulatory system, in that it is there. And here skeletal system, skeleton, bones, joints, cartilage we are discussing. Lymphatic system means lymph nodes, spleen and all we are discussing in lymphatic system. Then muscular system, system means skeletal muscles, smooth muscles and all the muscles and tissues we are discussing in muscular system. Respiratory system, lungs, trachea and alveoli, all are there, that one we are discussing in respiratory system. Then it is going to nervous system. Nervous system, in that brain, spinal cord, nerves, neurons, that one we all are discussing in nervous system. Then digestive system, mouth, stomach, intestine, all are discussing in digestive system. Endocrine system, already I told, hormones and all, so glands, pituitary, thyroid and all, hormone secretion, all we are discussing in endocrine system. Reproductive system, male and female reproductive gonads, how the progesterone, estrogen and testosterone are means secreting and all we are discussing in reproductive system. And urinary system means kidneys, ureter, bladder, all we are discussing. Our excretory system is this one only, urinary system. Okay, so these are the 11 body systems we will discuss in later one by one. Okay, so today just you remember the names, what means what. Okay, next nervous system we will discuss. Okay, now we are going to go for the body cavities. Next part is our body cavities. Body cavities, so main cavities are main cavities are, first one is dorsal cavity, and second one is ventral cavity. This dorsal cavity again divided into two. One is cranial cavity and one is vertebral cavity. And here ventral cavity again divided into, one is thoracic cavity and one is abdominopelvic cavity. Abdominopelvic cavity. Okay, so one by one we will discuss. First we will discuss about ventral cavity. Sorry, first we will discuss about dorsal cavity. First we will discuss about dorsal cavity. In that, first one is cranial cavity. Cranial cavity. Cranial cavity, in that what is there? Brain is there. Vertebral cavity. Vertebral cavity, it is the spinal cord. Spinal cord is there. And then what is there? Ventral cavity. Ventral cavity. This is also two types. First is thoracic cavity. Thoracic cavity. In that what will be there? First is there lungs, heart. These both are there in thoracic cavity. Next is there abdominopelvic cavity. Abdominopelvic cavity. In that what will be there? Abdominopelvic cavity, in that stomach is there, liver is there, intestine is there, and bladder is there. If I will show you one picture, means you will be very much easily you will get. That one is, see, cranial cavity. You can see here cranial cavity, this one. In that what will be there? Brain will be there here. Okay, then ventral cavity, sorry, vertebral cavity. Vertebral cavity is this one full. In that what will be there? Spinal cord is there. So this one is full dorsal cavity up to cranial to vertebral cavity. Full is called dorsal cavity. And here you can see this is ventral cavity. Ventral cavity, what will be there? First one is thoracic cavity. Thoracic cavity means this all area full. Thoracic cavity. Here you can see lungs will be there, heart will be there. So this is thoracic cavity. And next one is abdominal cavity. Abdominal cavity is there. Abdominopelvic cavity means up to here to this one. This is abdominal region, this is pelvic region. So up to here it is abdominopelvic region. Here what will be there? Stomach is there. Inside it is stomach is there, liver is there, bladder is there, intestines is there. So all will be called is a ventral cavity. Now body cavity understood, everyone? So total body cavities is two. First is dorsal cavity and second is ventral cavity. Dorsal cavity again divided into cranial cavity and vertebral cavity. Cranial cavity, in that what will be there? Brain will be there, and vertebral cavity, spinal cord will be there. And ventral cavity, thoracic and abdominopelvic. Thoracic, in that what will be there? Lungs and heart will be there. And abdominopelvic cavity, in that stomach is there, liver is there, intestine and bladder will be there. In pictures also I show you, and in that you can remember. Okay, so you people can think why this topic is important. This is very easy, and this is why this is important. As a nurse, we has to know where, if suppose a patient came, where that, which that area he or she is getting pain, so that area we need to locate. We should not tell no, downside, left downside, or right upside, like that we should not tell. We have to tell that which area, right abdominal region, or right iliac region, or umbilical region, or left hypochondrial region, which side we need to identify that one. Then physical examination time also we need to use that one. Or any disease condition, if you are getting, suppose anyone is telling that he or she is telling, I am getting right iliac region pain. So that time we need to get, this is appendicitis pain or McBurney point. So there only they will get pain if they are getting appendicitis means. So that one we need to get, means we need to know about this type of cavities and body structure. Okay, so that one. And with communicating with doctors also, we need to talk with this. Nowadays people's nurses are not talking with this, so that nursing, they are thinking they don't know anything. But while you will see any two doctors or two MBBS, they are talking, they are not using normal English, they are using full medical terms. And while you are going and you are thinking, today onwards you go, once you listen while they are talking, they will use all the medical terms only. So if you know this type of things clearly, means you also understand what they are discussing and what they are talking. Understood? So for today this much. I hope you people found this video helpful. Today little bit fast I am taking the classes, and my handwriting also very much bad, but I hope you people will understand, and you people will read this type of things. And okay, then for today this much.